Hi, my name is Courtney and I'm here today with Dr. Aoyang, and we are going to be talking about some important things that you should know to take good care of your teeth. The tooth is a place where germs live and grow, and these germs are called dental plaque. Plaque is clear and sticky, and because it's clear, you might not be able to see it, but it is there. It attracts and holds tiny food particles to the surface of your tooth. If these particles have a lot of sugar, the plaque turns sugar into acid, which erodes or decays your tooth. Tooth decay often leads to cavities. Is there a proper way to brush your teeth, or how long should we brush our teeth?
That's easy. You want to make sure that you're brushing your teeth at least twice a day, every day, morning and nighttime. You want to brush for about 2 minutes. And how to brush your teeth is you want to go ahead and take your toothbrush and comfortably hold it, and also angle the toothbrush head towards the 45-degree angle to the teeth, and actually doing small circular motions with the toothbrush for both sides of the teeth, the front sides as well as the insides. Front teeth as well as toe the toothbrush to the inside edges here. And you would do the same for the top teeth as well.
So I noticed that you were using very soft strokes, but is it better to brush hard or with less pressure or more pressure?
When you're using a toothbrush, you're using a soft toothbrush, and you want to go ahead and use kind of fairly soft pressure there because you want to be able to massage the gums as well as take off the debris in the food. If you press too hard, you'll actually cut into the gums and actually erode away the neck part of the tooth.
So I know it's difficult to get in between your teeth with the toothbrush, and how can we do that? Do we use floss?
Yes, definitely. Along with brushing, flossing is just as important. You're going to go ahead and take a 12-inch piece of floss, kind of wrap it around your fingers just, fairly loosely. You're going to go in between each of the contacts of the teeth here and actually kind of scooping up any of the plaque and the food debris between the teeth, so that way the gums stay healthier.
So my dentist tells me that it's important to brush my tongue. How do I do that?
Brushing your tongue is just as important. After you're brushing your teeth and you're rinsing out, your tongue still has stuff on there, like food, even plaque as well in the taste buds. So what you're going to do is you're going to use a tongue cleaner, which is the most effective, and you're going to go ahead and towards the back part of your tongue, and you're going to kind of gently press onto the tongue and scrape off all the debris. You do it 3 times on your tongue, and then it's off. And that helps to prevent stuff from getting stuck in the taste buds as well as prevent bad breath.
So I noticed when you were showing us how to brush our teeth that you were brushing the gums. Why is that important?
Well, brushing the gums is just as important because the gums are the supporting structure of your teeth, as well as the bone that keeps the teeth into the socket. If you don't take care and maintain your gums, then what's going to happen? You're going to get gum disease or periodontal disease. And that happens to do with the breakdown of the foundation of your teeth. So what happens is that if you're not brushing properly and flossing, then you're going to get breakdown. Tartar is going to build up and make the gums swollen and bleed a lot, and then it gets to a point where they don't really attach to the teeth very well, and then you'll lose teeth. And that's actually the #1 cause of losing teeth today is periodontal disease.
And how can we prevent periodontal disease from occurring?
Daily maintenance of brushing and flossing at least twice a day, and also seeing the dentist at least twice a year, or 4 times as necessary or needed.
So you mentioned going to a dentist to get a dental checkup. How often should we go, and what happens during a dental checkup?
Well, it's recommended that you go twice a year, every 6 months, to go see the dentist more if needed. And during a dental checkup, we look at the soft tissues like the insides of your cheeks, lips, tongue, as well as the gums, as well as the teeth, to make sure everything is healthy. We also check the gum pockets, which is part of the periodontal disease exam, to make sure that the gums are healthy and that there's no loss of tooth support.
Okay. And what happens if a person does have a cavity? What does the dentist look for?
Along with the exam, we do digital x-rays, and that helps to determine whether or not there is a cavity present in the tooth. So if there is, then at the next visit we would go ahead and take out the soft tooth structure, which is the cavity, and replace it with.
So I really like to eat sweets and chocolate and cake, but I know it's bad for my teeth. So how often would you recommend eating these sweets or treat snacks?
Well, Well, we all know that cake and cookies and candy are not the best things for our teeth because they do cause decay or cavities in the teeth. And we can't really necessarily delete that from our diet because that's something that we use to celebrate special occasions. But after you eat, candy, sweets, chocolate, cake, anything like that, just make sure you brush your teeth and floss afterwards.
Great, well thank you for being here with us today, Dr. Aoyang, and thank you for watching. I hope you learned a lot about how to take care of your teeth